Welcome to the Dental Pro Tech Talk, the ultimate show for dental professionals staying on the cutting edge of dentistry and technology. Join us as we explore the latest advancements from soft tissue diode lasers and teeth whitening to imaging breakthroughs and beyond. We're here to help you future-proof your practice and deliver exceptional patient care. Whether you're a dentist or hygienist, this podcast is your go-to resource for tips, growth, and all things tech.
Welcome back to Dental Pro Tech Talk. I'm so excited for this deep dive. We're talking all about lasers in dental hygiene. And to help us unpack this topic, we have a true expert joining us today, Angie Wallace. Angie is an RDH with over 30 years of experience. Not only is she a hygienist, she also holds that prestigious Academy of Laser Dentistry Mastership and Educator status. She's a published author, sought-after speaker. Basically, she's like the ultimate guru for hygienists who really want to master lasers.
What a lovely introduction. I appreciate it. I do go around and teach laser courses in private situations, dental meetings, all that fun stuff. So if you ever need training for your office team members, please feel free to reach out to me. I would love to help you.
Angie, one question I feel like we hear all the time from dental professionals is, what setting do I use on the laser for, and then they insert whatever procedure it is. Like everybody is searching for that magic number.
I would say the one thing that I get asked 99% of the time is, what setting do I place my laser at to do such and such procedure? And I think that's such a interesting concept because there's so much more into it than what we see. And I think that if people get stuck in just doing the presets, which are awesome guides for us when we first start with lasers, but if we just get stuck in pushing a button and using that setting, we're going to see that in some situations it works, and in a lot of situations it doesn't. And so one of the things that I have really tried to focus on with teaching my courses is to teach my students how to read the tissue, see what you're seeing, to know what it's doing. Because if you have one setting, you're going to get different results with different patients, especially in different chromophores of tissue.
Read the tissue. Okay, now that sounds intriguing. I know that lasers target specific things within the tissue. Can you break that down for us a little bit?
It means quit just thinking you can use one setting to do everything you can with a laser. For instance, there are suggested settings that will come up when you push a button on your laser. Those are programmed in as kind of a medium, kind of the in the middle type setting, but it all is going to depend on the patient's chromophore of the tissue. For instance, one of the things that our diode lasers are attracted to are dark pigmentation. So that can be melanin in the tissue, that can be to bleeding. And if we're looking at those two things, the more melanin we have in the tissue or the more hemoglobin that we have in that tissue, the laser sees it faster, if you want to call it that. It sees it faster and it's going to interact faster. So we need to be able to turn that up or turn that down depending on what we're trying to do.
So how do we know if we're using the right settings? What should we be looking for?
So I tell everybody that I usually start at 0.5 watts of power. That's kind of my starting point if I'm doing laser-assisted periodontal therapy, which is going to be decontaminating a pocket. I'm going to get in there after I've done my scaling and root planing procedure, which I prefer to call periodontal therapy. Periodontal therapy for me is kind of a little more updated term than what scaling and root planing is. And in our office, we don't have a choice of using the laser or not using the laser because we're always going to use the laser with this procedure. So our patients don't get to decide, do you want to use the laser today or do you not? That is our complete process, is to decontaminate the tooth surface through hand instrumentations, ultrasonics, all those wonderful things, and then to take our laser and to work on the gum tissue. So two separate procedures to complete the task, to completely decontaminate the surface of the tooth and the gum tissue so we can get new tissue attachments to help maintain and close off those pockets.
So how do we actually read the tissue? What are those visual cues then that are telling us, oh, we've gone too far with the laser?
So to read the tissue, when we put it at a setting, we have to see what's taking place. So remember, our laser doesn't have a thermostat. It doesn't show us what temperature we're reaching. The tissue will heat up according to the setting we're using and do a few things. For hygienists, we can do subsurgical settings. But for dentists, we know that if we cross the line between subsurgical and become a cutting tool, that it's going to interact with the tissue differently. because everybody's tissue is different, that's where that fine line is. It's very easy for a hygienist to set the setting too high and start cutting the tissue because of the chromophore and the bleeding. For instance, if I had a patient that was from Jamaica and had very dark melanin and pigmented tissue, the laser is going to interact with that tissue faster than if I have somebody with a lighter chromoform tissue. So I need to be able to adjust that setting so that I'm not crossing that line and making it as a cutting tool for a hygienist. Of course, as a dentist, you can certainly cut tissue, but as a hygienist, we have to work in with our scope of practice. So if we're starting to see where that tissue looks a little sticky and it looks like it's kind of stringy, maybe it's starting to turn kind of white as you're working around that gum tissue, more than likely you are starting to cross the line and become outside of your scope of practice. So you need to be able to read the tissue and know that you need to do a few things. Either turn your laser down, move a little bit faster, or maybe help cool off the tissue with your high volume evacuation to be present right there next to those areas, not only to control the plume and the toxins, but it also does help cool off the tissue.
It's like detective work, right? Using those visual cues and the patient's feedback to really fine-tune our approach. You've emphasized working within our scope of practice. Let's talk about those laser techniques that hygienists can confidently utilize. You're a big proponent of the tip-to-tissue technique. What makes this technique so important?
There's so many people that just go straight into the pocket and don't try to angle it towards a tissue. Now, you can curve the tip of your fiber. You can have the tips already pre-curved as the AMD lasers come. Some of them like to use them straight. You can use little tools and all kinds of different things. But if you don't focus the tip to the tissue, whether it's a dentist cutting tissue, working on tissue, or a hygienist trying to go into the sulcus, you're going to miss part of that tissue interaction because our tips do not work on the sides. They only work on the tip. That's the only place you're going to get tissue interaction. So you almost have to visualize that the circle of the end of the tip is going to need to touch as much of the tissue as possible to get the best relation with interaction to the tissue.
So no more just waving the laser around in the pocket.
So I know that gets a little confusing because it's like, well, how am I supposed to do that when I'm in the sulcus? But just don't be pointing on the tooth. And make sure that if you take the curve of your fiber and lean it against the tooth, then your tip will always be placed in the correct direction. I've said this many times. People start off really great and they're doing some up and down movements and back and forth. And then they go around from the buccal to the lingual of the tooth and they don't change the position of their tip. And all of a sudden the tip is now pointed at the tooth instead of the tissue.
I love how you make these concepts so easy to understand. So with the tip-to-tissue technique, how exactly do we move that laser fiber within the sulcus? What's the best approach?
So ergonomically, you need to position your patient so that when you rotate the tip to the tissue, that you have as much of the tip touching the tissue as possible. Now, what directions do we move that laser? It can be in circles. It could be up and down movements. I usually teach the up and down movement. I call it a cross-hatching motion.
So no more vigorous scrubbing with the laser.
So I'm going to walk the tip into the pocket, similar to what I would do with a periodontal probe. And I'm going to do up and down movements with my laser in the sulcus and my tip against the tissue. But then before I come out, I'm going to do side-to-side movements, which are going to overlap or crisscross over that vertical movements that you were using and now doing horizontal movements so that you cover as much of the tissue as possible. If you think about it, if you just go in and start swirling that tip around, you're probably going to miss interaction on some of the tissue. And we want that tip of the tissue to interact with as much of the tip of that surface of the tissue as possible.
I like it, cross-hatching with the laser. So it's all about methodical coverage. How does the depth of the pocket then affect our technique?
We don't have to say we can only stay in for a certain amount of time because that's all going to vary on the depth of the pocket. So for instance, if I have a 4 millimeter pocket that I'm treating with my laser, that's going to take me a lot less time to cross-hatch in that diseased pocket than it would if I had an 8 or 9 millimeter pocket, because I'm going to need to spend more time in the pocket because there's more infection. So a lot of times on the AMD lasers, I don't use the timer because I want to be able to stay in the pocket for the length of time that I need to So for me to turning off turning off that timer just keeps me focused on what I'm doing, not having to take my foot off and then put my foot back on to reset the timer.
So it's not about speed, but it's about being precise and deliberate in our movements.
There again, you might want the timer. That might be your indication to know that you've completely lasered that pocket in that particular time frame. So take into consideration the depth of the pocket, not only the depth, but also I'm going to say the width of the pocket, because that becomes your working distance on where you're working. For instance, if I'm on the buckle of tooth number 19 and the mesial buckle has a 4 millimeter pocket, the straight buckle is a 3 millimeter pocket, and the distal buckle is a 5 millimeter pocket. If I go up and down in those areas, it's going to all vary because of the depth of the pocket. And if I start going side to side and try to cover that whole buckle surface from the 4 on the mesial all the way to the 5 that was on the distal, I could take a chance of breaking a tip because I go side to side. I might drag that tip over part of the tissue and run into it, for lack of a better word, and allow that tip to break. The good thing is the tips are pretty strong and they hold up pretty well, but we don't want to have to be retrieving a tip out of the periodontal pocket because we weren't understanding what the tissue is doing. We didn't understand where the tip needed to be. We didn't understand the movements. We were going too fast. And so all those things in conjunction will help us be able to understand what we need to do with that tip.
Now, let's talk about a topic that often sparks debate in the hygiene world, initiating the laser tip. Can you explain what this means and why it's such a hot topic, especially for hygienists?
Do I need to initiate the tip? This is always a huge thing that is brought up. First of all, what does initiating the tip means? It means placing it where you have something dark that is placed on the end of the fiber. Some states will tell hygienists that they can never initiate the tip. You just cannot touch it on articulating paper or the cork that's with some lasers. You can never do that. What I will tell you is if you have dark disease bacteria into a pocket, sometimes the tip will initiate in the diseased tissue that's in the sulcus.
That's fascinating. What does that mean for hygienists working within their scope of practice? Does a self-initiated tip put us outside of our boundaries?
No, because the settings that I'm teaching hygienists to use are those subsurgical settings as they're reading the tissue. And so if it initiates and our setting is low, it does not necessarily make it a cutting tool. If we increase our wattage, then we could create a cutting tool. So we need to be very careful of that and understand what that means.
So it's not a black and white rule, but rather a mindful approach. We need to be aware of what's happening and use our professional judgment.
Some people are saying they're always told to initiate the tip. I'm not going to tell you that's wrong. I'm just going to tell you you really don't need to as a hygienist. You can use an uninitiated tip, whether it's herpetic lesion, aphthous ulcer, desensitizing the tissue, LBR, LAPT, hemostasis, all those wonderful things we can do with an uninitiated tip in hygiene. So another person says, I was told never to initiate the tip or to replace the tip if that became initiated.
Okay, and what about speed? How quickly should we be moving that laser fiber within the sulcus?
Well, as I said, you're not going to stop it from initiating because that's what it's seeking out in that diseased pocket. But what you need to do is, there again, read that tissue. If you notice that it's starting to look sticky or stringy, or you're getting too much coagulum on the tip, my first suggestion for you is just to turn that laser down. That's going to be what it is. It could be that you need to maybe speed up. Here I've been talking about slow down because 99% of the people go too fast with their laser, but maybe you're going too slow. Maybe you need to speed it up a little bit so you're not stopping in each particular area. But think of it like painting with a feather. You're going to be consistent movements, not a sewing machine stabbing up and down, but consistent painting with a feather where you're moving up and down into that sulcus and then moving side to side just very fluently. And that's going to be your best bet to not start heating up that tissue too much. But slow down in most situations, read the tissue, possibly turn your laser down.
That's a great tip. Speaking of tips, I know you have strong opinions about laser use for pocket decontamination compared to other treatment options like Ariston.
No comparison. Yep, I'm recorded as I'm saying that. No comparison. You can place materials in a chemical into the pocket, but it's not getting any of that stuff out of there. And that's the whole purpose. If we just have a chemical that's sitting in there to destroy it, where's it going? Where if the laser is attracted to it and we're collecting it on the tip and we're wiping it off the tip, we are eliminating that out of there where the Ariston isn't doing that. So I have over the years continued to see Ariston diminish in where people thought it was wonderful, and I'm probably going to get like hate mail from them, but I don't think there's any comparison. I would never, I have never used Arrestin and I never will. I will pick a laser. I would quit dental hygiene if I didn't have my laser.
That's a powerful statement. You're a true laser evangelist. And after everything we've discussed today, I can totally see why. You've taken us on a journey. From understanding those fundamental laser terms to mastering the art of reading the tissue, if you had to condense all of this knowledge into key takeaways for our listeners, what would they be?
So a few final tips. Don't get so stuck in those settings. I want you to use those if you're a new laser user to kind of start to understand what the laser is trying to get you to do, but make sure you're reading the tissue. So it's okay to work outside of the box and see what's happening with that patient and that tissue. You have control over turning it down. You can reach over very quickly and turn it down just as easy as you can turn it up if it's not doing what you need it to do. Next thing, slow down. Like I said, write a sticky note, stick it on your laser, stick it on your chart to remind you to go slow, especially when you're running behind with a patient. It's very easy to think you can just laser real quick and get in and get out. You're wasting your time. It's not doing what you need it to do, and therefore you're not going to get the results. So slow down, don't go so fast. Make sure that you allow that laser fiber to interact with the diseased tissue, and then place the tip to the tissue. Remember, if it can see the tissue, it can interact with the tissue and do what it needs to do. If you have it turned the wrong way, you're never going to get that laser energy to do what it needs to do and therefore not get the results.
Absolutely. I'm already starting to see how lasers can transform a dental hygiene practice, but it's also clear that there's a learning curve involved. It's not as simple as just pushing a button.
So whenever somebody tells me that they hate a laser and it doesn't work for me and it's just not, I just don't think they work, these are the few things that I go to with them. Tell me what setting you're using. Show me how fast you're going or how slow you're going, and show me how you're placing that fiber. Because if these three things are followed on every single patient, you're going to get the rules and the regulations, and you're going to get all of the great takeaways from everything you can with the laser. And then maybe in 25 years, I'll be listening to you talk about the laser, so you don't have to keep listening to me, because until then, I'm going to continue to preach these things because I feel that these are the main things that we as laser educators and laser users can do to make sure we get the best results with that.
Those are fantastic guiding principles for anyone incorporating lasers into their practice. Angie, this has been such an insightful conversation. I'm so grateful for your time and expertise. I know our listeners are walking away with a ton of valuable information about lasers and dental hygiene.
Thank you so much. Everybody have a wonderful rest of your evening. And I look forward to hearing from any of you if you have any questions. Thank you.
And to our amazing listeners, thank you for joining us on Dental Pro Tech Talk. We hope this deep dive into lasers has ignited your curiosity and inspired you to explore the incredible possibilities that this technology offers. Remember, knowledge is power. Keep learning, keep growing, and keep raising the bar in dental hygiene. Until next time.